Good afternoon, Rotarians and guests. Welcome to the Rotary Club of Toledo. At this time, I'd like to ask Reverend Gail Catanella to come to the podium to deliver a reflection and to lead us in the Pledge of Allegiance.
Good afternoon, everyone. And happy Thanksgiving. I mean, we're almost there, right? I hope this means that you've started planning, if not purchasing and cooking, because we have expectations for Thanksgiving, don't we? We have ways to do this holiday. We know, of course, the truth is that not everyone does the holiday the way we think it should be or has the opportunity for that. And so we want to bring it back to what everyone can do. Everyone can give thanks. Everyone can count their blessings. Everyone can care about someone and say thank you to someone. That's really the heart of this holiday, isn't it? Putting the thanks back in Thanksgiving. I want to say to you that if you are not going to have a good holiday, if you know that someone who you wish was there is not coming, if you have to work or wish you were working, if you lost someone this year and this will be the first time you'd have a Thanksgiving without them, I want you to know that our hearts are with you and our prayers are with you. But it brings us back to what Thanksgiving's all about, doesn't it? That we can all count our blessings, that we all have good things in our lives, and we also include Rotary among them. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Reverend Gail. I also want to say thank you to you and the Peace Committee and Community Services Committees for the work that you did through the Neighbor to Neighbor program throughout this election season. Thank you for bringing the community together. I appreciate it. As we begin our meeting, I'd like to thank and acknowledge Hartman Bogan as this month's sponsor and Rotarian Donna Bogan. I don't know if I saw Donna out in the audience today, but thank you very much, Donna. We appreciate your support. If anyone has any guests they would like to introduce, I invite you to bring them to the floor mic, so we can clearly hear and see you and your guest. Again, we ask that members introduce the guest with name, company, and role only in the interest of time. Guests, we're excited you're here, but we don't want to hear from you. That's not what the script says. Jackie's way nicer than that.
Good afternoon. My name is Kelly Mofield. I'm with the Kidney Foundation, and this is my colleague, Paul Villafranco, who is our Community Outreach Coordinator. And
Excellent.
we're here to support our friend Sharday, who shares office space with us.
Awesome. Kelly, Paul, thank you very much.
Congratulations, Shardy.
Hello, President Kevin. I have with me our Program Director out at Lot Industries in the Inspiration Kitchen, Sandra Irvine. And she'd like to say something.
No.
She's gonna.
That's not going to happen. No, because you're going to make me violate the rules. We'll schedule time to talk. Don't make it hard.
Thank you for your generous donation to the Inspiration Kitchen. We were just awarded. Thank you.
See, I want you to do that up here.
Hey, I have Fonda Royster with me. She is the founder and CEO of Open Arms Transformational Living. She's a guest of LaSharday Scott, but I came to introduce her since LaSharday is speaking today. Welcome.
Awesome. Thank you very much.
President Kevin, I have with me today Tim Berta, an alumnus of Lourdes University and a recent published author of a book called Fielder's Choice.
Tim, welcome. Thank you for being here.
President Kevin and fellow Rotarians, I have three guests today. My first guest is Lisa Anderson. She is a community affairs leader with Owens Corning.
Lisa, welcome.
Thank you. My second guest is Dr. Patrice McClellan, but she goes by Dr. P, from the Ronald Group. She's the president. And then we have Kira Brock. She is a recent graduate of Masters from UT. Thank you so much.
Awesome. Welcome. Thank you for being here.
President Kevin, everybody, happy Thanksgiving. I've got two guests with me today. Both glad to say are from our office and joined our sort of what we call our college team at Toledo tomorrow. Kalfani Rice, over here on my left side, I guess, and this is Mitchell McKenzie, both Toledo natives, and glad to have them here at Rotary.
Awesome. Welcome. Thank you guys for being here. All right. If I could have everyone that is wearing a Rotary pin, please stand. So I had told you sometime in the month of November, we're going to be counting who wears a Rotary pin, and a donation is being made. Jim, remind me what the donation per member is? $10 per member. So I would say if you are a Rotarian who is sitting, you owe the foundation $10. If you are standing, you probably also owe the foundation $10, but maybe more. We'll talk about that on December 9th. All right, Jim is counting. I'll leave it to the CFO. He got your number. We'll send you an invoice. Perfect. Is there anyone else that was not counted? Let me tell you what, slackers. I am standing as well, Jim. All right. Thank you very much. We appreciate it. As I've said, if you do not have a Rotary pin, talk to Jackie, talk to myself, and we will get you one. I have heard throughout this month, as we've talked about this challenge, a number of you have told me stories of being stopped while you're out in the community and having conversations about Rotary and the Rotary pin and the connections that makes. And so we certainly appreciate those of you that wear it, not just on Mondays. Maybe you didn't bring it today because it's on the suit that you wore yesterday, and that's why it's not here. So, Allison, that's exactly what it is, right? Perfect. Okay. All right. I also want to say thank you to everybody who attended. Can I just show of hands who attended the Holly Trolley? That was a lot of fun. Thank you to everybody who was there. I don't know if we've got photos up there or not. Yeah, there we go. There's our group. We had lost a few people at this point, I think. I mean, they left. We didn't lose them. We knew where they were. They just called it a night already. So thank you to everybody who attended. The second annual Holly Trolley was a lot of fun. And we did not lose anybody this year, which was an improvement over last year. So thank you to everybody. Thank you to Jackie and Karen, everybody that helped organize this event. So thank you. I also need to acknowledge a couple people that are in the room, and that'll jump to my next area of business. We do have our district governor, Tim Ryan, is here. So Tim, thank you for joining us. For the newer Rotarians, our district sort of oversees a lot of the clubs in Northwest Ohio, District 6600, and we're blessed to have the district governor, the leader of that area, as a member of our club. So, Tim, we appreciate all you're doing to lead this area. Thank you. I also want to acknowledge a visiting Rotarian that is here that certainly wasn't going to go to the microphone himself, but Mark Makalinsky, it's always good to see you back in town. Thank you for being here. We had the privilege, and I felt very proud, although maybe I didn't deserve to feel proud for him, but while we were visiting Rotary International headquarters in Evanston, Illinois, we had a chance to see a couple of their different donor recognition areas, and it was awesome to see Mark and his wife recognized for their contributions at the international level. And I can just say it's incredible the leadership that you give to Rotary, the way you challenge us. We appreciate it, so thank you very much. Lastly, it's my pleasure to inform you that we recently approved a new batch of Rotarians. During Tim Ryan's year as president, he would always say, "You are the newest Rotarian in the world. Right now, you are the newest Rotarian." So please join me in welcoming the newest Rotarians in all of the world. Vince Azzarello from Emmanuel Christian School, Tiffany Bosch from the Sylvania Area Chamber of Commerce, Vincent DePofi from SSOE, Ronnie Gilmore from Spin and Splat, Natalie Greiser from Knight Insurance, Robert Pasker III from Pasker Real Estate, Summer Vrieslar with Neuter, and Susan Wingate with Water Wine Venue Hall. If you are here, I'll ask you to please stand. I saw a few of you coming in. Welcome to Rotary. All right, let's get to today's program. Without further ado, please put your hands together and welcome fellow Rotarian, Dr. LaSharde Scott.
afternoon, everybody. All right, so you are going to learn a lot about me. Everything that I do is personally connected, so we'll talk about that. But today, we're going to break the barriers of shattering the myths that sickle cell disease is only a Black disease. So just a disclaimer, this is just a presentational for educational purposes. I am not a medical doctor. So my why, before I start with anything, I always have to start with my why. That's just a social worker in me. So in 2015 and 2016, I had 2 children diagnosed with sickle cell disease. And that sparked this great interest of me getting involved with sickle cell. I am a Detroit native, and I lived in the Ohio area for the last 7-8 years. And there was a lack of resources for sickle cell families or patients. And I went back to Detroit to educate myself because a organization here failed me as a parent. So that sparked me going back to school to just learn what I needed to do to be the best parent that I can be, because as a parent, you want to make sure that you protect your cubs, right? So that was what I wanted to do, to make sure that I was advocating best for Emory and Evan. And that led for me to go on and get my doctorate, and all of the education that I've done in my doctoral studies started the Scott Center for Observation, Treatment, and Transition. And we are the first nonprofit in the state of Ohio to focus primarily on transition sickle cell patients from pediatric to adult care. Bear with me. Next slide, please. So I believe in the quote, life without purpose is meaningless. So I know everything that has happened in my journey was meant to happen. It is who I am. So the objectives today, I'm going to tell you a little bit about who's impacted by sickle cell disease. We're going to recognize why those myths exist, that sickle cell disease is a Black disease. And then I'm also going to talk about advocating for inclusive education and healthcare practices. So you're going to kind of learn a little bit. You can go. Next slide, please. So Scott Center for Observation, Treatment, and Transition is a 501(c), and we focus primarily on sickle cell, infant mortality, and mental health. And we were founded in 2022. As I said, this was during my doctoral studies, but I've been working in Toledo area for the last 7 years for sickle cell patients. So even before having my own organization, I constantly drove the mission to be able to educate individuals who were not aware and just reducing those stigmas. So this is nothing new for me, but it's definitely something that was needed for this particular community. So I work in 11 counties of Northwest Ohio. Unfortunately, at this time, I am a team of 1, but starting next year, I will have a bigger team. So I'm excited about that. Oh. Okay, I got it. So what is sickle cell disease? It's an inherited red blood cell disorder that affects the hemoglobin in one's body. It also affects the cells to receive oxygen. So this causes the shells to become like crescent moons, and it often causes pain episodes, blood blockage, and organ damage. So a lot of times patients are really, really dealing with a lot of pain. They were born with this disease, so they learn to manage it. And the only way that you can get sickle cell is that you have to have 2 parents with the trait. So as shown in this picture here, there's a 25% chance every time I have a child, I will have a child with sickle cell. There's a 25% chance that I won't have a child with sickle cell, and then there's a 50% chance of having a child with sickle cell trait. So I wanted to explain that. And no, you do not get sickle cell disease from sickle cell trait. It does not turn into disease. It's either you have trait, you don't, or you have disease. So those are the options. Next slide. So the faces of sickle cell. I don't know what happened. Can you go back? Thank you. The faces of sickle cell disease. 1 in 365 African American births are impacted. 1 in 16,300 Hispanic births. 1 in 25,800 Asian Pacific Islander births, 1 in 41,600 non-Hispanic white births. So yes, sickle cell disease does impact more African Americans. However, they also impact individuals from Spanish-speaking regions such as South America, Caribbean, Central America, Saudi Arabia, India, and then Mediterranean countries such as Turkey, Greece, and Italy. So we're gonna debunk that myth. It's not a Black disease. It's everybody's disease, right? Next slide, please. So my question is, why aren't we addressing the health disparities in Black and brown communities? So I want to give you these two options. So sickle cell versus cystic fibrosis. We know sickle cell disease, well, it's estimated that sickle cell disease approximately impacts 100,000 Americans. I already gave you the statistics about Blacks and Hispanics, but also 1 in 13 African Americans are diagnosed with sickle cell trait, and there are no comprehensive clinics. This is due to systematic racism. More predominantly African Americans are impacted by sickle cell. So we have 3 times less the funding compared to cystic fibrosis, where Caucasians are more impacted. So they have their numbers down packed. There are close to 40,000 children and adults living with cystic fibrosis in the United States, and 105,000 of those individuals were diagnosed across 94 countries. There's approximately 1,000 cases every year of CF being diagnosed, and there's more than 75% of CF patients that are diagnosed by the age of 2, and more than half of the population is 18 years of age, and they have comprehensive clinics. They're able to give that data because they have funding. They have a national database. So when I say systematic racism is real, it's real. We don't know the exact number for sickle cell patients, and we always have to approximate this number when reality is way more, because by 2050, it's supposed to raise by 30% that more people will be diagnosed with sickle cell, but we don't have an accurate number. So that's alarming. Next slide. Go back. Okay. So some of the disparities, even within the clinics that they share, sickle cell patients and oncology patients share the same clinic. However, they are treated so differently. So if you go into oncology, hematology department, you will see all of the yellow ribbons, pink ribbons. You never see a burgundy ribbon to represent sickle cell. But yet this is a clinic that these patients are coming to get their treatments done every day. So why aren't we being intentional by making sure that we show representation on both? I say it again, systematic racism is in it. It's in everything that pertains to these patients, and then yet we still want them to feel empowered. So what we do at Scott, these are some of the things that we do. We advocate. We go into the clinics. I have collaborative efforts with the local hospitals and primary care providers, and I'm making sure that I go in and I put their representation up. So some of the impacts, you can go to the next one, that's fine. So some of the impacts of the disparities, the psychological impacts. So patients feel like they're neglected or that they don't matter as much as a cancer patient. There's a reduce of self-esteem. There's negative impact on how the treatment is given. So when we talk about even as low as adults going to get treatment, they're perceived as, drug seekers. Their pain is not real, those types of things. So there's a lot of stereotypes and misconceptions when you're talking about sickle cell patients. And then it also misses the opportunity for community building and raising awareness for these individuals. Next slide. So I want you to hear what my son, this is Emery, he's 9 years old, thriving with sickle cell. Can you play this for me?
Emery Scott, some of y'all. I'm Dr. Scott. I appreciate everything you do.
Don't be the what else do you know you have?
And as you were saying, pediatrics to adult care so that you can make sure we have everything we need to feel better.
Yeah.
Aww.
Next slide. So everything I do, as I said, I'm trying to mitigate the barriers that patients and families endure. Myself, I've had my own barriers. So to hear my son say those things, you know, obviously I'm headed in the right direction. So this past February, I went to Rare Disease Week for the first time. And I mean, there's all types of people with different more than just sickle cell, just any rare disease you can think of. And I created this one pager for legislators to have an understanding of like why sickle cell is important and why they need to create more funding. And I talked about the problems, once again, of the existence of systematic racism and the disparities that sickle cell patients and families endure. And basically, giving them the historical context of like when sickle cell was first observed by a dental student by the name of James Herrick in 1910, all the way to the Association of the Sickle Cell Association of America being created in 1971, to the Sickle Cell Disease Treatment Centers Act in 2022, and now we're in 2024. So patients were not living as long as they're living now. If you went back to the 70s, patients were dying, you know, between age 14 and 21. Now they're living well into their 80s. So when we talk about the disparities of what are we lacking? So there are really a lot of hematologists, adult hematologists. We already struggle with the children, the pediatric, but now we're struggling with adults. So now people are lacking knowledge on how to take care of these patients. So then that comes with those misconceptions of, oh, they're just drug seeking, oh, they're frequent flyers, and I hate that word because that's not the case. A lot of the times they have all of this medication at home. So if they come to the hospital, they've already been suffering a week. Did you hear that? They've already been suffering a week. A crisis can last anywhere between 7 to 14 days. So to be in agony, and then you have to come into a hospital where people are judging you and they have their own misconceptions, their biases, whatever, you just want to get the help. So why is it that I have to battle with the hospital, right? Can you go to the next slide, please? So once again, so some of the misconceptions and the stigmas of sickle cell patients. So we know that health-related stigmas occur, whether that's actual or perceived. Like I said, they're considered to be drug seekers, liars, having jaundice of the eyes. They associate that with another, infection, when really the reality is sickle cell patients' blood cells break down every 10 to 20 days. But if you do not have sickle cell, your blood cells break down every 120 days. So you can just imagine how exhausting that can be because they're constantly working, right? Your pain isn't physical, so it's not real. So because they don't have a bald head, like we know with cancer patients, you have more empathy for them. But when a sickle cell patient says that they're in pain, it gets unnoticed. Only affect people of color, which I already debunked that myth. And then being perceived as lazy, and then some cultures just believe in prayer. I believe in prayer, but I also believe in medicine. I also believe in like holistic approaches. So there's lots of things that we can do to make sure that patients are getting the treatment that they need. Okay. So as I told you before, I used a lot of my doctoral studies to drive the mission, to educate, empower. Go back. Okay, so we have a 4-step process of identifying the barriers of transition. So this is published in Oxford's Journal. And basically, what I wanted to do was to get social workers involved from the beginning process. So we know establishing that rapport is important for patients because this population does not trust easily. So they're not going around saying, I got sickle cell, even though I empower my kids to tell people. But a lot of times they're not just disclosing that information. So care coordination, we want to make sure that we have social workers, community health workers, navigators, whatever you call them, in the forefront of everything. But then hematologists, doing that, taking them to the second step, which is the multidisciplinary approach, to make sure that they feel supported and that that jargon is not lost, because we know medical doctors use a lot of terminology that patients and family typically don't understand. So then we're making sure that the social worker is bridging that gap. And then we know that achieving this seamless transition, we want to make sure that there's operation of hours, transportation, and then we know once they go from pediatric to adult care, the insurance change. So now we have to work with paperwork. A lot of times they need help with that paperwork. And then addressing the social determinants of health. So we know housing, education, finances, those things are what they're thinking about before they even think about their condition. So they're battling all these things. So think about a child that's getting ready to go to college. All of these things got to fall into place. So I wanted to make sure that I was very intentional on creating a transition model that other orgs or hospitals can follow, because it didn't exist. So this was published this year, so it didn't exist. So now organizations are starting to implement how to utilize this model to be able to help patients navigate the healthcare system and just their daily life activities. Next slide. So as I stated to you before, so I gave some recommendations. We need to educate more hematologists, so starting some type of fund or scholarship to get especially more individuals of color to go into this field. I advocate for that a lot, because we know when we see people that look like us, we tend to have better health outcomes. But more importantly, just establishing, that getting rid of that absence of healthcare that we're dealing with the hematologist, but then also creating mandatory trainings for anybody that's working with sickle cell patients. I don't care who you are, whether you are at the school to the hospital. I think everyone needs to have a level of understanding of what these patients are enduring and what they have to overcome constantly. And then creating comprehensive centers, primarily for sickle cell patients. As I said, they do not exist. So patients need to have somewhere where they feel safe and they feel empowered to be able to come and share their stories without being stigmatized. So I told you all these things, but I also like to share a strength-based perspective. So thriving with sickle cell, my two warriors, they are not their diagnosis. They excel. They're great, they're athletes, even though, a lot of times hematologists tell them that they can't play sports. I do not put limitations on my children. I let them decide what they can and cannot do, but I do inform them to let their coaches know, even though Dad and I, we tell the coach, but we give them the power to be able to explain to the people that they're playing with. And that's just the first step of just empowering them and letting them know that they're not their diagnosis and not enabling them. So I definitely had to share that, because there's a lot of sickle cell patients that are doing some great things in this community. So I just think it's important that we continue to show that they're resilient and that they're doing the things that they're set out to do. So as I stated earlier, turning my personal experience into my own journey to be able to empower and educate everyone around me. I'm always creating toolkits, whether it's for new social workers. I work with TPS, and I'm working with their nurses and social workers on staff. I'm educating. I just think that it's important, because you don't know what you don't know. So all of you here today should feel a little bit smarter in this area, like you know a little bit more, right? And then you can share that with somebody. Just to share this, so this is in a public library. I finally got it in Toledo Library. I've been fighting to get it in there. So what this book is, it is an introductory book that my husband and I wrote. It's through Emery's eyes. At the time, he was 3, so he's 9 now, but he was 3 years old. And we just wanted to be able to give families a way to tell other people, whether it's school, whomever, right? Just to educate. So it's an introductory book. It gives you all of the key points that you need to know. And I also have it in a couple of the schools for TPS, so check it out. And then I just wanted to talk about the importance of collaboration. So I love Kelly. First of all, I have to thank the Toledo Rotary Club, because if it wasn't for them, I wouldn't have met Kelly. I met Kelly being a member here last year, and our missions aligned. I was looking for a space. She needed help getting into more communities of color. And I'm like, this is a great partnership. 30% of my patients will incur kidney complications. So the intersectionality, we were very intentional when we started our partnership. But I say that to say I'm giving a call to action to everybody in this room, because if it wants to turn, can you click? Thanks. So go back to call to action. Yes, okay. So I am asking, and these are just a few people that I've worked with, but if you are working with communities and families, they may be impacted by sickle cell. Like I said, this community does not just open up and share with just anybody. I am a resource. Like I said, I am the only person in this area doing work with sickle cell patients. Please share my information, because a lot of times they are not aware. And once again, I never want a family to feel the way I felt when I found out about my kid's diagnosis. So I want to make sure that I'm being intentional to share that information. Next. So, how you can get involved. Okay. We're just having a time with this thing. Okay. So how you can get involved with the sickle cell community, you can partner with Scott, that's one. So you can partner with me. You can participate in Sickle Cell Awareness Month, which is the entire month of September. June 19th has always been Sickle Cell Awareness Day, which is since 2006, let me say that. So you can do some events with us on that day. We typically do some things at the library where we're doing a lot of like campaign awareness. So you can join us on that. You can donate blood. We are really experiencing a shortage on blood donations. We have patients that are on chronic transfusions, and we need more minority blood donations, to be very honest. But yes, you can host a blood donation or blood drive. And then today, you can spread what you learned today. If you tell a friend and they tell a friend. So the next slide, we are bringing back our 5K. I hosted the first 5K run walk in 2019. I had over 400 participants. I would love to have that same momentum. We had over 50 vendors to be able to bridge the gap for all of those resources that are available in Toledo. I believe in collaboration very, very much, and that's one thing you're gonna know about me. So if you wanna be a part of this, you can reach out. We'll make sure that we have you put down for a vendor table, or if you're gonna register to join, start a team, all of those things. So it will be September 20th of next year at Ottawa Park. And then, I just want to thank everybody for allowing me to come and speak to you about sickle cell, educate you a little bit. And if you have any questions, this will be a good time.
Thank you so much for bringing this topic to us, as I think that this is a very, it's a shadowed topic. There's not a lot of spotlight on it, so thank you for the work you're doing in the community. As a parent, can you talk a little bit about the symptoms your children have and how you all work through that and the services that they receive? Because I know that that's a battle every single day to ensure that your kids have everything they need to thrive. So if you could speak to that experience a little bit.
Yes, so so to your first question. When COVID happened, nothing changed for my household because we were already living like that, to be very honest. So you can't come to my house if you're sick. You can't, because their immune systems are not as strong, right? I did have to shift day to day. So Dad was the primary care provider when I couldn't keep a job for 2 years because Emory was in and out of the hospital. So when I say I'm intentional about Scott, I'm trying to set up resources to help other families who may not have a second parent that's involved or who are doing these things alone, whether it's mom doing it or dad doing it. So I think for me, the everyday, like I never get to clock out. My work is always going on. Sometimes my husband gets on me like, you gotta find a thin line between helping people and, but I'm so passionate about it because it's me. It happened to me. I'm a part of this product too, right? But I didn't let it define me. What I did was I let it inspire me to be able to help other people not feel that void. So I hope I answered what you were asking.
Thank you, Doctor, for your talk. Can you tell me if there's a positive diagnosis, how that factors in terms of any Social Security disability award or workman's compensation awards?
So that's a really good one. So I struggle. I got denied all the time, right? But now they're, as of October of this year, they created a whole guide, and I have them in my office and they're on my website to tell you how to apply for Social Security. Now, I don't know how long they're gonna keep it up because we're the only diagnosis that has this book, but it shows you how to do it as an adult and a child. So now they're allowing us to be able to do those things. But I know the minimum is that you had to have a crisis at least twice in a hospital, and it had to be a hospitalization in order to receive those services.
Thank you so much for all the information you shared. I was born with sickle cell trait, but I did not find out until I was in my mid-20s. Can you tell me what is changing in the field of women's reproductive health, and that those of us that may have the trait are educated in a reproductive manner in the same way we would be for having a child born or a partner that also has the trait, and what that could mean for our lives? I remember when I found out, even though it was not yesterday, like I like to think it was, I was very disappointed because I just could look back at how many times I had seen a doctor about my reproductive health and it was never discussed, ever.
Yeah.
Can you tell me what is changing in that field, if it's changing at all, and maybe why that happens?
So, great question. March of 1990 is when it was mandated in the state of Ohio to test every baby at birth. So if you was born before 1990, okay, so so you may not have been tested. However, it was not mandated in the United States to 2006 for every state to test every baby. So that's that. Now, a lot of times, if you look like you have a little melanin, those doctors will ask, well, do you have sickle cell trait? When they should be asking everybody. But I always tell people, even if you haven't been told, it's a free test. You ask your doctor just to do an electrophoresis or a sickle cell test to see if you have the trait. I thought I had prepared myself because I was told that I had sickle cell trait, but my husband wasn't. He was diagnosed, he was born 6 months before me, so he was not tested, but I was. So I knew my status, he didn't. So I tell people, don't listen to grandma or auntie, just go get tested. That's the safest way. But that test is supposed to mitigate what you're talking about. It's supposed to decrease people going through that. But even more importantly, now, if you're playing sports, you have to provide your newborn screening because the NCAA was sued because a patient died on the field from sickle cell trait, from overexertion and dehydration. So that's another topic that we'll talk about, but yes, there's a lot of things that we need to be privy of when it comes to sickle cell trait or sickle cell disease.
What does a sickle cell patient, what is it that they're going, when they're going for treatments, when they're experiencing what they need to get to help them, what all are they going through?
Are you asking like the pain?
Like the treatments, like is it when they're going, like I think as you said, so when they go to the centers, like what are they receiving?
So my children, I'll speak on my kids first. They go every 6 weeks because they're on drug medications to help decrease them being in the hospital. So just to be clear, they were on 2. One was pulled by Pfizer just this September. They just took it off the market So my kids ended up having pain crisis because of them just pulling it off, because they had their own reasons why they did it, right? But they get their blood managed to make sure that they don't have to readjust the medication that they're taking, but also they're looking at their retic counts and their blood levels to see where they're at, because if you get to a 4, you have to get a blood transfusion. My children have been fortunate enough, average person's blood levels are usually like 13, 14, 15, somewhere in there. They're roughly 10 and 11, so they're not too bad considering that they have sickle cell, right? So those are things that they're looking at. And then you have some patients that are on chronic transfusions when they have to come in and get this blood exchange, or they need, just to be infused to keep their fluids up. So there's a lot of things that goes on in clinic, but like I said, they're not always feeling empowered because there's no representation of them in that clinic. Yeah.
Thank you.
Mm-hmm.
Tyler Sade.
Hey, Paul.
So I was curious, I know you talked about beginning partnerships with TPS, and then it just got me thinking about the education system. And basically, I just wanted to ask, like, are there barriers to getting into maybe private schools and other entities? I don't know. You know that I'm from Texas, and there's tons of school districts there, but I'm not quite aware of the total system here, if there's multiple competing districts. And if so, are there barriers to getting into those districts? Are there barriers to getting into private schools? And if so, how could we as a community kind of try to help spread that messaging and get you into those spaces? Because if the populations and the communities are being affected, but the message isn't there and the staff doesn't know, then it just feels like there's going to be a neglect to those students.
So to be quite honest with you, I typically started with the patients that I serve, what schools they're at. That's how I started. I haven't really had any pushback as far as like coming in, because usually I'll come in and speak to the teachers, any of the staff members. I'll talk to them, and then I've been able to have the opportunity to talk to classes when they're working on like Punnett squares or probability and cause. And that's when I come in to talk to the students, because I felt like that was my mission. I grew up in Detroit. 60% of the population in Detroit has sickle cell trait. They were never in the schools. So you spent more time at school than you did at home. And if we're pushing that narrative and we're telling the students about these things, then they go home and they ask questions. So that was my thought process of like making sure that I had those partnerships with the schools to be able to drive the education that way. So as far as like how other people can help, is just spreading the knowledge here, what you learned today, to say somebody at the school could be impacted. I got one school where it's a lot of patients there. They done started a support group at the school. That's how many kids are at the school. So, I think it's really important for everybody to kind of, know what resources are out there, but also share the knowledge to say, hey, this is your go-to person because she has resources to help you pay your rent, or, whatever it is specifically for sickle cell patients, or if you need help with drug medications, paying for that. I have the resources to do that. So it's just a matter of like, just letting people know what's available.
All right, thank you.
Thank you, Dr. Lasharde. This is helpful. But I wanted to share a resource with you. I remember in the 80s that, I'm aging myself, right? I remember in the 80s that the University of Toledo had a program. It was NYSP, and I was tested there in the 80s. The University of Toledo doesn't have that program, but Case Western has that program still, and they may be able to, I'm believing, if I can remember correctly, they still test for sickle cell. When you mentioned in your presentation about collaborations, and I was like, oh my gosh, I have to give her this information, because it's free to the children that are in that athletic, and they do all of the sports. So that may be a really great resource for you in terms of collaboration. So I just wanted to share that with you, because I know it saved my life, because we didn't know what it was in the 80s. And I believe they're still doing that today.
Okay, thank you.
Hi, Deborah Ayers from the Avalon Foundation. First of all, way to go, Mom. Amazing work that you're taking your experience and helping others. And I love the empowerment that you're giving your children. That's incredibly important. These kids that grow up young with medical challenges build a lot of resilience. You know, that's measurable in the psych world. And we need more of that out there if they're being challenged by these early childhood traumas, really. And obviously, the equity and access is challenging. You've clearly demonstrated that. And if you already answered this question in your presentation, there was a lot to digest, but my question is, how is access to care through insurance? Is there any inequity in that? And is there a cost that is sometimes hard to access? Can you talk a little bit about treatment and insurance? And is that smooth for the process, or do you have issues with access through that as well?
So, pediatric has all the bells and whistles. That's why I wanted to start Scott, because I felt, even though I deal with patients from birth to end of life, right? When you get to the transition, that's where the health declines. It's expensive. I have patients that are trying to debate if they want to pay their insurance or eat. And that's, to me, that's sad. It's disheartening. You shouldn't have to choose whether or not to take your medications to live or to eat. So I am working with some other sickle cell organizations that do legislative work to drive the mission on the importance of the Sickle Cell Treatment Act. Now we got this new administration, no disrespect. I don't know how it's gonna look for patients.
Sure. That's not uncommon in the rare disease world.
Yeah.
And I'm glad that you identified yourself. So the Avalon Foundation is also part of the rare disease world. And there's a lot of really good conversation generating around these issues that I think we'd love to have your voice in as well. So
Okay.
we'll get
Do you
together.
plan to come to Rare Disease next year, February?
Yes, and I'm also going to be speaking at Rotary for rare disease in February.
Okay,
So
cool.
thank
All right.
you.
Hi, LaCharde. Thanks for coming today. I've got a different kind of question for you. Who's your favorite baseball team?
I'm really not a baseball girl.
Okay, well, that's a good answer, because I'm going to try to recruit you to become a Pittsburgh Pirate fan. It's kind of lonely out here in Toledo. And the reason I ask that is I grew up in Pittsburgh in the 60s and 70s, and there was a Hall of Fame player there by the name of Willie Stargell. So when I was probably 10 years old, myself and the Pittsburgh community all knew about sickle cell because Willie Stargell was a huge advocate of it. And I felt blessed to know what that was as a young kid. And I'm teasing you a little bit, but he would be very proud of the work you're doing today. So I thank you for that. And blessings to you and your family as you deal with this. Thank you.
Thank you.
Thank you so much. You never know what kind of questions you're going to get from the podium. So that was quite the curveball there. Dr. Scott, thank you very much for your presentation. In appreciation, we do have a gift for you, a copy of Historical Tales of Toledo, authored by past President Clint Mock. We're also going to make a donation in your name to the Polio Plus Fund to join with Rotary International in eradicating polio from the earth. So thank you for everything you're doing. One more time for Dr. LaCharde Scott. We are off next week in observance of a long Thanksgiving weekend. Then we've got two great programs left before the end of the calendar year. Foundation Day is December 9th, and the Toledo Symphony is performing here at Rotary on December 16th. Please bring guests to all of those programs. Historically, I would look at Foundation Day and say that's an internal meeting. That's a meeting for us. To talk about what we do and why and how we do it. As we've had conversations about this year's Foundation Day, I really think it's about everybody. And I would encourage you to bring guests that you're interested in learning more about Rotary, specifically to that meeting, to learn about what we do and why we do it and why it matters. And why adding 6, 7, 8, 10 new members every month is helping us do more of that great work in the community. So we look forward to seeing a packed house for both of those meetings. There are, speaking of the great work we're doing, there's 3 committee meetings this afternoon. Youth Services is in Summit A. The Golf Outing Committee is in Summit B. And the Peace Committee is going to be meeting here in the ballroom. If you are not currently on one of those committees, I'm not going to make you stand and embarrass you today. I might do it again in a future meeting. But if you'd like to participate, stop in, see what the committee's like, see if it's something that you want to be involved in, and if it's something that aligns with your personal passions. So thank you. There is a lot to be thankful for. I have people ask me all the time, are you having fun in this role? And I will say overwhelmingly the answer is yes. I've got a lot to be thankful for. As I look out in this room and I see people that are partnering with me, I believe that we can change the world, and I believe that the Rotary Club of Toledo is the right vehicle to do that. So as we head into Thanksgiving, I just want to say thank you to each and every one of you for what you do, for the time, talent, treasure, and influence that you leverage to make our community better. So with that, go out and make it a great day. We are adjourned. Happy Thanksgiving.